Hello, good afternoon, good evening, good morning and welcome. It's Nurse Richard the Wax Wizard. I'm going to start this video by showing you a still image which you can see here of what this ear looked like afterwards, and those two areas there is exposed bone, which is obviously not supposed to be there. So let's see how we get to that point. I'll tell you a little bit about this gentleman. I've never met him before, and the symptoms that he'd been describing where he'd had occasional otalgia, ear pain, on and off for a few months, and he obviously had a lot of trouble hearing. He couldn't hear anything at all out of this ear, which changed actually after we removed this, unsurprisingly. But I'm not entirely sure as the reason what caused this. And it flummoxed me a little bit more when we see the other ear. Now, there's nothing to do in the other ear, but it's quite an amusing tale in his other ear, which will explain why he hasn't been to see me sooner. And we found something quite interesting and quite amusing in his other ear, which is at the very end of the video. So please stay tuned to that. And I've left the patient's audio in there. And his reaction was priceless when we found what we found in the ear. I know it's a bit cryptic that, but it's worth it. So yeah, he couldn't hear, experiencing quite a fair bit of pain, and he noticed that it'd been happening for about 2 months. His hearing had just pretty much gone, but he couldn't come to see me. Now, the reason for that is when he first rang me, I think I was on holiday. It may have been half-term break. I was off with the children when they were off from school. That's right, it was autumn half-term. And he didn't, because he knew of me, he didn't want to go and see anybody else, because he's aware, as most of you probably are, there's quite a few cowboys out there. Let's not beat around the bush and let's call a spade a spade. And that's what a lot of them are. So he said, but he couldn't get in to see me because he was going away. And he was going away to Perth in Australia for a couple of months. So he said, well, it's not too bad, I can manage it, but I'll certainly see him when he comes back. So he came back, and his ear had got a little worse over those 2 months. So I managed to fit him in as an emergency. Glad I did as well. A very difficult removal. Also, the reason why he was in Australia, I'm not entirely sure, but what I'm getting at here is the second ear that I was talking to you about sooner. He brought something back from Australia, which you will see at the end of the video. So already here, I'm suspicious. I mean, I was suspicious. As soon as you see all this dead white skin in anyone's ear, you should always be a little bit suspicious, because there's often things lurking underneath it. It's a sign that things are not going very well, and that certainly was the case in here. As you can probably already see, very difficult stuff to remove because it's really thick and it's really stuck to the base of his ear canal. But when we lifted it up, I mean, already I can tell that there's erosions in this ear, because if you can just see to the left-hand side there, is pink skin, and then there's quite a clearly defined ridge, isn't there, where there's the white dead skin, and there's a ridge of that pink skin. So there's the skin that was previously in the canal is not there anymore. Now, there's a few causes for that. Well, two main ones. The first one is you can get a problem. Well, probably three. You can get a problem with the blood supply in the ear. Now, he didn't have any other coexisting medical conditions that might indicate that he has an issue with blood flow anywhere. That's not to say that's not the cause of it, because when you get restricted blood flow anywhere, the tissue that's relying on that blood, which carries oxygen, it just dies. And that can happen. That's not uncommon in the ear. The other cause of it could be canal cholesteatoma. Now, he could have two of these, possibly three. And this is when you get a collection of dead skin in the ear, which he's clearly got, and then that starts burying deep down, and it kind of erodes away the skin, and it can erode the bone. And I'm still undecided as to what happened. The fact that it's just like his other ear was perfect, other than this thing we found in it. So what that tells us, that it's just like this in the one ear, I'm not entirely sure. But obviously he got a referral straight away to the specialist. So if I do get an update, I will let you know. As I've told you before, I don't often get updates, unfortunately, from ENT. I know they know me. I know how to get in touch with me. So I always ask the patients to let me know what's been going on. And some do, some don't. But I usually find out when they come back. So in the base of the ear canal there, you can clearly see there's the yellowy substance just in that little hole, that crater. Again, I think that's exposed bone as well. It's more obvious in this one, it's just off shot at the moment to the left-hand side, because when I touched that with the suction probe, you could feel the bone, you could feel it kind of grating against it. Have a look at this. You could feel it grating against it. I was not expecting this to come out. And it was when this came, look at this, it's like this big sack of goo encased in some dead skin. Yeah, when that came out, that's when he noticed the biggest difference in his hearing. But yeah, not a pretty ear canal, unfortunately, this one. I mean, I'll be honest, I was quite happy with everything that we did manage to get from here. Could there have been an infection in this at some point? That's possible too. It's also possible, going back to the third reason, you can sometimes have like a particularly bumpy ear canal. Not all ear canals are smooth. And as the skin migrates out the ear, the epithelial migration, I know your regulars will know all this, if some of the skin can then fall into some of these depressions, bumps, troughs, which can be anywhere in the ear canal, and then they can start to collect in there, and as the new skin is travelling along the ear canal as it tries to get out the ear, it can again fall into this trough, build up. You can sometimes get little infections under it, which again can expose the bone, kind of erode the skin away. That can happen too. But yeah, that area there, which you can quite clearly see, but you can't now. There you go, I'm just pulling back, just on the left-hand side there, that little crater there, that is definitely exposed bone. So I've already exposed the main problem in this gentleman's ear. What I'm trying to do now is get his hearing a bit better. Now, this is always an area that's difficult for me to get into. It's always difficult to get into the roof of someone's ear canal. Okay, you need to often get in a strange position, or see if the patient can tilt their head away as far as they can. And particularly this side here, where it's kind of top left corner, I find tricky because I'm left-handed, so I'm using my left hand with the suction probe, and it is a tricky area to get into. But I was more than happy with everything we got out of there, because it's basically this debris, dead mushy skin that's kind of stuck to the eardrum, and at a couple of points as it comes away, you will see the eardrum just flex a little bit. That's why I didn't hang around in there too long, because you don't want to push your luck sometimes. You have to know when enough is enough. You know, we've clearly already exposed the problem, but I just want to make sure that there's nothing lurking in this area as well, which is a common area to have the beginnings of a middle ear cholesteatoma, which is a growth of skin that goes behind the eardrum. It can be obviously quite serious. And you see the eardrum just flexing a little bit then. So we can see almost all of the eardrum, so I'm already pretty happy at this point. Trying to get a few more bits, but like I said, you don't want to push your luck sometimes. So I've sent pictures of this along with an accompanying letter to the patient's GP, who will hopefully get them a very urgent ENT referral so they get this looked into. Now what I'm doing here, I'm just touching up against that just to confirm in my mind that it is bone. You could quite clearly feel it scraping against it. It doesn't hurt when you do So when we get onto the second ear here, I'm going to be quiet for a minute, and I'm going to turn up the audio from the procedure so you can hear the patient and the patient's reaction when we look at his other ear, and see if you can figure out what it is before it's revealed. Here we go. You can see a difference there, can't you?
Big difference, yeah.
Absolutely spotless, though. Have you been to the beach recently?
I was in Australia.
Do you know why I'm asking that?
There's a bit of sand in there.
Yeah, that's exactly what that is.
Oh dear, eh?
Wow, you brought a little bit of Australia back with you. That's right, it was sand all the way from Perth in Australia. He'd brought a little bit of Australia back with him. You can see his ear jumping up and down, couldn't you, as he was laughing. But like I said, I will keep you updated on that one if I hear anything. And if you enjoyed this video, then feel free. I would really appreciate it if you could subscribe to the channel or follow it, whichever platform you're watching on. And if you really enjoyed it, then you can consider becoming a member of the channel, and you get daily videos. Anyway, I hope you enjoyed that, found it interesting. But for now, take care of yourself, and I will see you soon. Ta-da.